Foundayo, or forglipron, is a once-daily weight loss pill, and nausea is one of its most common side effects. At higher doses, roughly 1 in 3 people reported nausea. The important part is timing. Nausea appears most often when treatment starts and after dose increases, then becomes less common as treatment continues. There is no single week when everyone feels normal. Foundayo acts like a gut hormone called glucagon-like peptide 1. This signal helps reduce appetite and food intake. It also slows how quickly the stomach empties. That stomach slowing is strongest after the first dose and becomes weaker with repeated treatment. This helps explain why early nausea can be intense, then ease as the body adapts. That early stomach effect helps explain the symptom, and the trial results show how often nausea appeared at each dose. Across the main weight loss trials, nausea occurred in 26% at 5.5 milligrams. It occurred in 34% at 9 milligrams and 35% at 17.2 milligrams. Nausea was also reported by 10% taking inactive placebo pills, showing that nausea can occur even without Foundayo. Those percentages describe people who reported nausea at some point during the trials. They do not mean 35% felt sick every day. They also do not tell you how long each episode lasted. The prescribing information gives a clearer pattern. Nausea was more common during dose increases, then became less common over time. That timing matters because Foundayo is not started at a full dose. Treatment begins at 0.8 milligrams once daily. After at least 30 days, the dose increases to 2.5 milligrams. After another 30 days, it increases to 5.5 milligrams. Later increases depend on benefits and side effects. So one person may feel nausea, mainly after starting treatment. Another may feel better, increase the dose, then notice nausea again. A later wave can happen after a dose increase, before the body adjusts again. When symptoms return soon after an increase, the timing supports that explanation. This creates a pattern that can be confusing. Symptoms may feel rough at first, followed by a calmer stretch. Then a dose increase may bring symptoms back. The Food and Drug Administration label gives no fixed deadline for nausea to disappear. It shows instead that the overall rate falls with time. Eating behavior can amplify that problem. Foundayo reduces appetite, so the amount that once felt normal may suddenly feel too large. Continuing to eat after fullness can make a slowly emptying stomach feel even more uncomfortable. A heavy meal can therefore feel very different after treatment starts, even if that same meal was easy before. Simple adjustments can reduce that extra burden. Smaller meals may be easier than 3 large meals. Stop eating when fullness arrives instead of finishing automatically. Fatty foods can worsen nausea, while bland foods such as toast, crackers, or rice may be easier during a rough period. Those meal changes can make nausea easier to handle, but repeated symptoms after a dose increase still matter. Write down when nausea returns and how strong it is before the next dose decision. That pattern helps show whether another increase is reasonable. Reaching the highest dose is not automatically the goal. The prescribing information says later dose increases depend on benefits and side effects. If a lower dose is working but nausea limits daily life, another increase can make side effects outweigh the benefit. That trade-off matters because nausea is not just about comfort. Persistent nausea can reduce eating and drinking enough to cause dehydration. Vomiting or diarrhea can add even more fluid loss. The prescribing information warns that dehydration can contribute to kidney damage, especially when treatment starts or the dose increases. Being able to keep drinking is an important safety sign, not just a comfort issue. Most stomach and bowel side effects in the trials were still not severe. Among people taking Foundayo who reported these problems, 60% were mild and 36% were moderate. 4% were severe. That difference matters because a mild wave after a dose change is not the same situation as ongoing severe symptoms. Stopping rates show how much these side effects mattered. Stomach and bowel side effects caused 3% to stop at 5.5 milligrams. The rate was 6% at both 9 and 17.2 milligrams versus 0.7% with placebo. Most people did not stop, but the higher doses were clearly harder for some people to tolerate. The practical question is not whether you feel any nausea. It is whether the nausea is mild and fading or persistent and making it hard to drink, eat, or function normally. A short episode that improves is very different from repeated vomiting, dizziness from fluid loss, or symptoms that keep getting worse. 4 details help show whether you can keep watching symptoms or should call your doctor. Track when nausea started, whether it followed a dose increase, and whether you can keep fluids down. Also notice whether you are urinating normally. These details are more useful than simply saying, "Foundayo makes me sick." Keep a short daily record. Note your dose, meal size, nausea severity, vomiting, and fluid intake for several days. Look for whether symptoms are improving, staying the same, or getting worse. If symptoms clearly ease after a dose change, that supports the idea that your body is adjusting. If they remain strong or worsen, they are not settling down as expected. Patterns across several days are more useful than one bad meal. While you track symptoms, do not treat nausea as proof that the drug is working better. More nausea does not equal more weight loss. The goal is enough appetite control to support treatment without making normal eating and drinking difficult. Side effects are a cost of treatment, not a score showing that the medicine is stronger. Weight loss should not require feeling sick all day. Severe or persistent nausea deserves medical attention. Ongoing nausea, vomiting, or diarrhea can cause dehydration. The manufacturer specifically advises contacting your doctor if these symptoms do not go away. Severe, persistent abdominal pain is not routine nausea. Pain that may travel toward the back, with or without vomiting, can signal pancreatitis, which means inflammation of the pancreas. The prescribing information says Foundayo should be stopped if pancreatitis is suspected. That symptom pattern should not be watched at home as if it were routine adjustment nausea. For most people with mild symptoms, improvement over time is the key sign. Nausea that becomes lighter after a dose increase fits the trial pattern. Nausea that stays intense, repeatedly returns with vomiting, or prevents normal drinking, deserves a discussion with your doctor about the dose. During a rough stretch, keep meals smaller, stop at fullness, and keep drinking enough fluids. If a full glass feels difficult, take small sips more often. The immediate goal is to keep fluids down while you watch whether the nausea is easing or worsening. Foundayo nausea is common, but the raw percentage is only half the story. At higher doses, about 1/3 of trial participants reported nausea, yet the rate was highest during dose increases and fell over time. Fading, manageable nausea fits the pattern seen as treatment continues. Persistent nausea, dehydration, or severe pain should prompt a call to your doctor. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.